It's a holy time when a patient is taking their last breath. For the most part, I've tried my best to give comfort at that time. There are many who have stated there are worse things than death. One study in 2016 asked end-stage patients about dying and found that more than 67% stated that needing a breathing machine was a condition worse than death. Mr. B was an 84-year-old retired farmer who had been struggling with chronic obstructive pulmonary disease, or COPD. This condition is related to the loss of ability to exhale normally, which in turn is due to the destruction of tiny alveoli, which are oxygen and carbon dioxide exchange units. This results in large, unfunctional pockets of air, which block the flow of air going out. He had smoked and had extensive exposure to toxic farm dust throughout his life, and now he was on continuous oxygen therapy and couldn't do anything without running out of breath. He had been on pulmonary rehabilitation or exercises to stay in shape, a low-carbohydrate diet, metered dose inhaler bronchodilators, and repeated antibiotics during his last years. This was the third time he was hospitalized in the last 2 months for exacerbation of COPD. He was in the hospital again with worsening of his lung disease and with the added challenge of bacterial pneumonia. His oxygen levels were dropping, and survival was going to require a breathing machine or intubation again. He had been intubated over several days during the previous hospitalization, and this time he did not want it. His wife had died a year earlier, all siblings had passed away, but his only child, a son, lived nearby. I will never forget the conversation the three of us had that day. We talked about Mr. B's poor quality of life. His options were either to be intubated again or to go with comfort care using an opioid. Mr. B realized death was likely, as did the son. Mr. B said, "Let's try the comfort method." His anxiety and shortness of breath were improved immediately after making that choice. And over the next 2 hours, as the pain medicines kicked in, Mr. B slipped away while his son was at his side. This is very serious business, and I usually encourage people who are aware of their situation to fight on. But Mr. B was very tired of fighting for breath. He was ready to let go. In this case, needing a breathing machine was a condition worse than death. After his last breath, he finally found relief.